Hey, I'm Noah. I've been on therapy to treat my HAE for almost 8 years. Because I've been appropriately trained by a RUCONEST patient advocate nurse, I am able to self-administer my RUCONEST. You can also get trained by a RUCONEST patient advocate nurse. They can come to your home and teach you how to self-administer. When you feel signs that an HAE attack is coming, you need to administer your RUCONEST as soon as possible to help get your symptoms under control. Preparing my supplies is the first step. I always keep my RUCONEST medication and all the supplies I'll need in the same place at home or with me when I'm on my way to basketball practice or to see friends. That way, there's no confusion about where my RUCONEST is if I start feeling the symptoms of an attack. It also makes it faster and easier to gather and organize my supplies when I need to. Let's take a look at how it's done.
RUCONEST should be stored in the original carton at room temperature. Before you begin the self-administration process with RUCONEST, wash your hands with soap and water and dry them with a clean paper towel. You can start by using an alcohol swab to clean the flat surface that you'll use as your work area. Allow a minute for the surface to dry naturally. Make sure you have everything you need to prepare and self-administer RUCONEST before you get started. Inspect the supplies to make sure you have 1 to 2 single-use vials of RUCONEST, as prescribed by your healthcare provider. Diluent vial. Diluent is sterile water. Needle-free, vented vial adapters, or large-bore needle, and 1 30-milliliter syringe. Also check for a standard butterfly catheter infusion set, IV administration set with winged adapter and needle. Once you've confirmed that you have everything you need to prepare your dose, check you have all of the other supplies needed to later administer your dose. These include a tourniquet, gloves, if recommended by your doctor, a bandage with adhesive dressing, sterile gauze and tape or transparent dressing, and an alcohol swab for cleaning skin. Be sure you have a sharps disposal container nearby and your treatment journal to record today's treatment. Also make sure you have a clock to monitor time. Next, inspect the diluent and 2 RUCONEST vials before preparing your dose. Do not use if the protective cap is missing or the expiration date on the label has passed. Now that you have cleaned and set up your work area with all of the necessary supplies, let's move on to preparing your RUCONEST dose.
Next, I get my RUCONEST ready to self-administer. There are several important steps here, so watch closely.
First, check that the RUCONEST vials and the diluent vial are at room temperature. Once you've inspected the RUCONEST and diluent vials, place them on the clean, flat surface you've just prepared. Next, remove the flip caps on each vial to expose the vial stoppers. Use the alcohol swabs to wipe the vial stoppers and allow them to dry for 30 seconds. Make sure you do not blow on the vial stoppers after wiping. Do not touch the stoppers with your hands or allow them to touch any surface. Peel back the cover from the first clear plastic vial adapter package. Place the adapter over the diluent vial. Press down on the adapter until you hear the device snap into place. Leave the package on the adapter until you're ready to attach the syringe. Next, pick up the other adapter and repeat with the RUCONEST vial. If your doctor has told you that you need to administer a second vial of RUCONEST, repeat this process using the other vial of RUCONEST that has been provided in your RUCONEST medication box. Lift the adapter packaging off the adapter on the diluent vial. Remove the syringe from its packaging. Keeping the vial on the flat surface, attach the syringe to the adapter on the diluent vial by rotating the syringe clockwise. Now, turn the diluent vial and attach syringe upside down and gently pull back on the plunger to begin withdrawing sterile water into the syringe. If your dose requires 1 RUCONEST vial, withdraw 14 milliliters of diluent. If your dose requires 2 RUCONEST vials, withdraw 28 milliliters of diluent. Note that there will still be some diluent left in the vial after you have filled the syringe. Now place the diluent vial back on your flat surface and detach the syringe by gently pulling the body of the syringe and rotating it counterclockwise. Remove the package from the adapter on the RUCONEST vial. Next, insert the tip of the syringe into the adapter on the RUCONEST vial. Firmly press down and rotate the syringe clockwise to secure the syringe to the adapter. Be careful not to push down on the plunger while attaching the syringe. Slowly push down on the plunger of the syringe to add 14 milliliters of diluent to the RUCONEST vial. Leave the syringe attached to the vial after adding the diluent. Next, hold the syringe and slowly begin to swirl the diluent and RUCONEST powder in the RUCONEST vial. Swirling the vial slowly helps to avoid foaming. Do not remove the syringe from the RUCONEST vial until the diluent and RUCONEST powder are mixed well. Continue swirling the vial slowly and mix until the powder inside the RUCONEST vial is completely dissolved. After reconstitution and prior to administration, inspect the RUCONEST vial for particles and discoloration. The reconstituted solution should be colorless, clear, and free from visible particles. Now you can begin to fill the syringe with your dose of RUCONEST. Turn the vial with attached syringe upside down. Slowly withdraw your dose of RUCONEST from the vial by gently pulling back on the plunger. Once you have withdrawn your dose, turn the vial right side up and place it on a flat surface. Disconnect the syringe by gently pulling and rotating counterclockwise. Be careful not to push down on the plunger while removing the syringe from the adapter. Please note that Noah only needs 1 vial of RUCONEST and diluent based on his weight and the dose he was given by his doctor. Your doctor will advise you on how much RUCONEST you need to administer. If you're using a second RUCONEST vial, you'll need to repeat the procedure we just went over. Please note that you will need to remove the syringe from the first RUCONEST vial prior to attaching to the second vial. Remember, the reconstituted solution should be used within 8 hours and should be cooled but not frozen. Now that you've completed the steps for preparing your RUCONEST dose, let's move on to the proper procedure for self-administration.
Once I double-checked that I have all of my supplies, I was ready to self-administer. Are you ready? Let me show you how I did it.
Since you've been handling multiple items, it may be a good idea to wash your hands again before you start the self-administration process. As a reminder, the supplies needed for this step include the RUCONEST syringe and the disposable supplies that are in your RUCONEST medication box. As instructed by your doctor, connect the infusion set tubing to the syringe filled with RUCONEST. Gently push on the syringe plunger to fill the tubing with RUCONEST. This pushes the air out of the tubing. Now, apply a tourniquet above where you'll be injecting RUCONEST. Clean your skin with an alcohol swab by wiping your skin in a circular motion. Start at the center of where you'll be injecting and move outward in a circular motion. Allow the skin to dry. Remember to follow the IV injection process as instructed by your doctor or other healthcare professional. Take off the needle sheath. Hold the butterfly needle between your thumb and index finger with the slanted opening of the needle pointing upwards. Insert the butterfly needle of the infusion set into your vein, making sure to insert it as flat to the surface of your skin as possible. Use sterile gauze and tape to hold the needle in place. After making sure the needle is securely in your vein, gently pull back on the syringe plunger. Check to see if blood is in the tubing. If there is blood present, then the needle is correctly inserted in a vein. If there is no blood, remove the needle and repeat this step using a new needle, new administration tubing, and a different injection site. Once you confirm the needle is in a vein and blood is in the tubing, remove the tourniquet. Now begin administering RUCONEST by slowly pushing down on the plunger of the syringe for 5 minutes. Next, remove the butterfly needle along the line that it was inserted and cover with a bandage, keeping pressure on the site for a few minutes. Properly cleaning up your supplies and workspace is important. After treatment, discard all unused solution, partially used vials, and used needles and syringes into an appropriate medical waste container. In your treatment journal, be sure to record each injection, including the lot number from your RUCONEST vial label and date and time of your injection. If your attack symptoms persist, a second dose can be administered. Most of the time, a single dose is enough, but a second dose may be needed. Remember, you should not exceed 2 doses of RUCONEST within a 24-hour period.
I'm all set. Time to go back downstairs.
For those of you watching today, please read and listen to the important safety information that will be shown now. And visit RUCONEST.com to learn more. Indication, uses. What is RUCONEST? RUCONEST is an injectable medicine that is used to treat acute angioedema attacks in adult and adolescent patients with hereditary angioedema, HAE. Important safety information. Who should not use RUCONEST? You should not use RUCONEST if you have a known or suspected allergy, hypersensitivity to rabbits or rabbit-derived products. You should not use RUCONEST if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. RUCONEST is not indicated for use in children under the age of 13 years. What should I tell my healthcare provider before using RUCONEST? Tell your healthcare provider about all of your medical conditions, including if you have an allergy to rabbits. Rabbit allergy testing is not required unless you get a runny nose, itchy nose, sneezing, coughing, wheezing, difficulty breathing, or watery eyes when you're near rabbits. Are pregnant or planning to become pregnant. It is not known if RUCONEST can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if RUCONEST passes to your milk or if it can harm your baby. Tell your healthcare provider and pharmacist about all of the medicines you take, including all prescription and non-prescription medicines, such as over-the-counter medicines, supplements, or herbal remedies. How is RUCONEST given? RUCONEST will be dissolved in sterile water and slowly injected into your vein, intravenous injection. Most of the time, a single dose of RUCONEST is enough to treat an attack, but a second dose may be needed. What are the possible side effects of RUCONEST? Allergic reactions may occur with RUCONEST. Call your healthcare provider or the emergency department immediately if you have any of the following symptoms after receiving RUCONEST: wheezing, difficulty breathing, chest tightness, turning blue, look at lips and gums, fast heartbeat, swelling, faintness, rash, or hives. In clinical studies, the most severe side effect reported was a severe allergic reaction in a subject who was allergic to rabbits. Other side effects patients experienced during clinical studies include headache, nausea, diarrhea. These are not all the possible side effects of RUCONEST. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, adverse event reports, and product complaint reports, please contact Pharming Healthcare toll-free 844-474-2764, main corporate number 800-930-5221, adverse event reporting, product complaints, medical information questions. Please see full prescribing information, including patient product information, linked below this video, enclosed in your RUCONEST packaging, or on RUCONEST.com.